Go Red for Women. Today is National Wear Red Day to raise awareness for heart disease, which is the #1 killer of women. And the American Heart Association's Go Red for Women movement is working to make sure women everywhere take action to protect their heart health. Sarah Pila is live at Dignity Health in Northridge with more. You wearing your red too there, or at least a red, there you go, sports bra girl.
Yeah, exactly, or lack thereof. But yes, Giselle, you mentioned it's so important, this cause, to really honor what heart disease really impacts both men and women. It's the #1 killer of men and women. But today we wear red to really honor the women and raise awareness, because oftentimes there's a lot of myths out there that women don't suffer the effects of heart disease like men do. So I'm here at Dignity Health with Dr. Saleh, who's a cardiologist here.
Good morning.
Good morning. And I'm undergoing a stress test on this treadmill to really gauge how healthy my heart is. So Dr. Saleh, tell me a little bit about what the stress test is and exactly what you're monitoring.
So a stress test is one way of determining if someone has heart disease. By way of the electrodes that are attached to your chest, we are monitoring the electrical activities in your heart. If there's changes within that tracing, that may suggest that there may be coronary artery disease.
So who's the ideal candidate or patient that would come in and need to undergo a stress test?
Women over the age of 55 and the men over the age of 45 are at risk of having heart disease. There are other risk factors for coronary artery disease, some that are, most which are modifiable, some that are non-modifiable. If someone has multiple risk factors for coronary disease, who's at an age over 45 for men, 55 over women, and particularly if they have any symptoms, a stress test may be ordered by their healthcare provider to rule out heart disease.
Let's talk about individual lifestyle for a second. How much does individual lifestyle play a factor in this, and what are some of those things that we should do to help prevent?
Individual lifestyle has a significant impact on preventing heart disease. Most of heart disease is modifiable and preventable.
Okay.
Smoking, for example, is the #1 preventable cause of death in the United States, and one of the most significant ways that it impacts people is that it causes heart disease. Obesity, lipid abnormalities, high cholesterol, for example, and diabetes. These are among the modifiable risk factors. And certainly stress in our lives can pose a risk of heart disease.
So what are some of the things we could do? Smoking is obvious, quit, but what about how can we manage our stress, and how about diet and exercise?
So having a healthy diet of having more fruits and vegetables, there are ways to combat stress. Probably the best way is exercise.
Really?
Perhaps meditation and relaxation techniques can be very helpful. If you smoke, stop smoking. If you have high cholesterol, you do want to pay attention particularly to the American Heart Association recommendations for a low cholesterol, low fat diet. So there are a number of ways that people can really change the trajectory of their risk factors for heart disease.
And are there any other myths surrounding heart disease, especially when it comes to women, that we should know? What kind of message do you want to send to our viewers today?
Well, I think that women need to understand that heart disease is the #1 cause of death in women, and know about their risk factors and do everything they can to modify those risk factors to prevent heart disease.
And I'm going to send it back to Giselle in studio, but do we have good news? Does my heart look healthy that I can tell her?
So far, you're doing okay.
Okay.
So I think you're in good shape.
All right, Giselle, that's good news for me. Lots of exercise, meditation, as Dr. Saleh mentioned, and a healthy diet, no smoking.
Yeah, all the things that we know and sometimes we don't pay attention to. But it was interesting to hear him point out that stress, the way, women hold up 3/4 of the house. Stress is such a big factor here. And you have been focusing also, Sarah, on things women can do to look out for our fellow sisters, right?
That's right. I think one of the biggest things that we should keep in mind is to have an accountability buddy, somebody that's close to you, a friend, a family relative, that you guys can monitor each other's blood pressure. Maybe it's somebody that you go to the gym with, or you go to a yoga class, or just have a couple minutes to sit and breathe in a meditation. I think it's important that we have that cohesiveness together to really help us stay accountable and look out for each other. I think that's a really important part of this, Giselle.
Oh, absolutely. That kind of network of support makes all the difference. Well, you continue on that stress test. I'm not surprised. You're doing quite well, my friend. The sports girl, you. All right. Thanks so much, Sarah Fila. Breaking a sweat there, like we all should do. Thank you so much.